Bullying in schools has been an issue for decades, but it seems as though this act has escalated over the years and through the use of social media. Many nationwide bullying issues, such as Columbine and numerous other school shootings, have been under spotlight by the media as a growing issue. In recent research of New York State's legislation on bullying, they currently mandate staff to participate in bullying education. It is recommended for students, but not mandated. Today, I aim to discuss the bullying issue and propose a new policy mandating yearly, age-appropriate bullying education program for grades kindergarten through 12. The goals of this policy are to educate students about the actions that define bullying, the effects, and knowing when to speak up. The effects of bullying include loss of self-esteem, anxiety and insecurity, negative effects on concentration and learning, avoidance of school, feelings of stupidity, shame, psychosomatic symptoms such as stomach aches and headaches, depression, physical injury, and at the extreme, suicidal or homicidal ideation. Victims may continue into college and adulthood with anxiety, lack of confidence, shame, and social withdrawal. Perpetrators of bullying are more likely to engage in other antisocial delinquent behaviors such as vandalism, shoplifting, truancy, and serious violence during adolescence and adulthood. They are more likely to be convicted of crimes by 24 years of age, and both groups are more likely to use drug and alcohol. To list some statistics, every 7 minutes a student is bullied, and 45% of students in schools were involved in bullying practices either as the target or as the bully. And many schools that implemented these bullying education programs saw a decrease of as much as 73% in bullying. The next question is, where do we see this and how does it affect nursing? Well, school nurses may see students with psychosomatic symptoms come into the office. Nurse practitioners and nurses in pediatric or family care offices care for the victims and perpetrators. Mental health nurses treat patients with anxiety, depression, anger, drug abuse, alcohol abuse, suicidal, homicidal ideation, as well as helping family and friends grieve over the loss of loved ones. And community or public health nurses could see the perpetrators learn behaviors in incarcerated individuals. And ER nurses may treat victims of physical violence, suicide attempts, and gunshot victims. Possible solutions include implementing a district-created program or purchasing programs that are currently available and tailored to different age groups, such as Rachel's Project. Based on studies from these implemented programs, if the mandated bullying education was used, we could interrupt the cycle of bullying from its start. As patient advocates, the health and safety of our patients is a top priority. The health of our patients, who include perpetrators and victims as individuals, and the community, could better now and in the future.